Hello, everyone. My name is Katie Reget. I am a administrative coordinator at a community health clinic known as Smiley's Family Medicine in the South Minneapolis neighborhood, and I lead the efforts related to health access, health equity, and health disparities at the clinic as it is associated with projects related to the surrounding communities. So I originally was born in Chicago, raised in Maple Grove, Minnesota, lived in Chicago for the last 8 years, and have been back in Minnesota for about a year and a half. I like to read and watch TV, huge fan of The Bachelor. I have a beautiful dog who I hang out with a lot and we do a lot of fun activities with. My path to becoming a professional in the STEM field has been a little bit convoluted, and to particularly land in the field of health disparities research and community engagement has been even more of a journey. I always was interested in science and mathematics. And when I was just 16 years old, I had an opportunity to go to a prestigious internship in Oakland, California, working in health disparities research before it became a huge field at the time, addressing sickle cell and thalassemia patients. And I got to go out there, I got to be really immersed in the field of science, and that just kind of set me on this track of somehow wanting to provide care. And I did do my undergraduate pre-medicine in biology. And then I just started to realize like I wasn't so much interested in the diagnosis and pathology of health, and rather the social determinants of health and what influences that. And that led me on the path to getting my master's in public health, commonly known as an MPH. So I did my undergraduate and my master's degree at the same university, and that is DePaul University in Chicago, Illinois. I am a first generation college student in my family and chose to follow a university path that provided me with a lot of scholarship funding at a Catholic university that has a huge mission to service and justice. And so I did both of my degrees there. I'm very fortunate that the degree and area I chose to pursue took a lot less school than the traditional physician provider. Health goes far beyond, a diagnosis. It is determined by your social strata, your racial identity, your cultural practice, your personal lifestyle choices, and to work in a field that is growing and expanding has been a huge honor. When I lived in Chicago, I worked really, really heavily with a lot of social organizations focused on a lot of these systemic issues resulting from racism in many communities on the west and south side of Chicago through a program called Ceasefire. And I knew I wanted to continue on working closely in communities that are different from myself and challenge my ideologies of cultural practice. So I found this opportunity that I have now at Smiley's Clinic in the south side of Chicago that really has a very strong presence in the East African community of South Minneapolis. I took a risk when I got this job in Minneapolis because I was entering a new environment I didn't know. And here, and my position in Minneapolis is a lot of, we aren't trying to remove the cultural practices. We're changing our health system to better provide access and care to individuals that have different things. So I really changed sort of my footing on what public health, how to address a public health problem. So a day in the life of a professional that's, practicing in community engagement, advancement, and health disparities research is really different. I would say we almost operate on like a cyclical nature, depending on where we sit in our projects. I think the best way I can share this like sort of transition is in an example. So I recently followed a project from start to finish as it relates to COVID-19. And that's the project I was on to help reach out to Somali speaking senior patients in our clinic, connecting with them when the clinics shut down, when the ambulatory centers shut down, when they were told not to go outside. What we devised was a program that was going to reach out to these seniors in their native language and connect with them and see how they were doing and answer any questions about COVID-19. The project started, like most projects, with a literary research where we took the opportunity to go out there and investigate what sort of fact-based information was out there, how has community outreach programs gone in the communities of service or like communities or anything like that. And what we found is a lot of research was lacking. Then we moved into sort of like the research methods project development phase. And what that was for us was we narrowed down questions like who's going to fund this project, who's going to be our workforce. And then we sort of went into the project implementation phase where things got going. We started reaching out, we started making calls, we started touching base with the volunteers, which were our workforce, on what resources did they need, how was the project going for them. And then it kind of summed up and we moved into the project evaluation or project review phase. And from the data we gathered and everything like that, we chose to move forward with publication. Then we moved into a phase of writing everything down, drafting our responses, submitting to a journal, getting information back from the journal. Now that project has sort of finished or finalized, where the publication was accepted by a paper and is now going to appear in a journal. As it relates to COVID-19, the working in the field of health disparities research has been brought to a new level than it's ever had before. This exposure of health inequity and health disparity on a rate that we've never seen before in our country. And so being a professional in this field of social epidemiology and the intersection of practical healthcare and as it's affected by race and systemic racism in our healthcare society, the question that I'm trying to answer as a professional is, what can I do? How can I make effective change? And how can our organizations make effective change that's going to change the sphere of healthcare like it's never done before? The idea that we can come and have this Zoom session just like we are today isn't always fair to the resources that an individual or a BIPOC individual may have access to. How do we translate language in a way that can be understood by a different member of the community that doesn't speak English? And as COVID-19 is calling on us to change the platform of healthcare to be one of greater access, it's also calling on us to change how we think about medicine. And when we say care for all, what is all? I like the trust and values of a provider sitting there and provide you facts don't weigh as much in a collective society as a community influencer or what your imams say or what your religious practices say or how your community has decided to encounter a problem. So in COVID-19, a lot of the Western tradition has been, top medical officials like Dr. Fauci coming on and saying, don't go outside, stay home, social distance, wear a mask. And that traditional medicine of a healthcare professional providing consultation like that is missing a beat in communities that don't necessarily place the same amount of value in medical-based fact and knowledge. But when you throw in a community influencer like an imam that says, Dr. Fauci's right, wear your mask, it's going to have a very, very different perception in a collective society as opposed to the traditional culture. And often, we're talking a culture that's commonly associated with Western, high socioeconomic white individuals. The field altogether is changing because COVID has exposed healthcare inequities on a greater level than ever before. First and foremost, I would say the value of mentorship is something that's really, really important. That's led me to the field that I'm in, and then the field that I want to continue to be in and exposing my horizons. So I would encourage any individual here who's, wondering about an experience or saying, hey, I don't know if I like this or I need to know more, to try to establish a mentor relationship in a field of interest. Another thing that I would share as it relates to this is in your professional career, you have to have a level of being okay to change with what the system demands of you. So important for us to call and make active change in our society when it comes to confronting racism.